Good day everyone. Welcome to the lecture video for the subject Fundamentals of Health Science 1 with the topic History of Healthcare. In this particular video, we will discuss the different discoveries, inventions, or developments and advancements that have happened during the different periods of time. So, let's get started. So before we discuss the different events that have happened during the different periods of time with regards to healthcare, we first need to answer the question, why do we need to study the history of science, specifically in healthcare? So let's get started. So yung first reason why you need to study the history of healthcare is that first, you learn what the world was like before we had our current understanding. So habang pinag-aaralan natin ang history ng healthcare, makikita natin kung ano yung klase ng knowledge na meron sila, ano yung klase ng healthcare system na meron sila, or meron nga bang healthcare system noon, like during the ancient times. So those questions can be answered while studying the history of healthcare. Second, as we learn how other people made new discoveries, we learn new ways of thinking that might allow us to make our own new discoveries. So, during our study of the history of healthcare, makikita din natin doon kung paano sila nag-come up with the different discoveries that they had and ano yung mga discoveries noon that can affect or that have affected the knowledge or the system that we have right now. So yung mga techniques that they did during those times can also be adopted by us, or it can inspire us to do some innovations in their ways of thinking or techniques para makadiscover din ng bago pang knowledge. Third reason, as we learn about the history of science, we learn about great men and women who thought outside the box and often went against convention. So, kung mapapansin nyo later on dun sa discussion natin, some great people who discovered great knowledge during those times, some of them have sacrificed their life, their time, by sa pag-study or sa pag-discover ng mga new knowledge. So, in that way, while studying the history of healthcare, we will know them better and mas makikilala natin sila and how or what inspired them on sacrificing their time and efforts and their life, of course, to the discovery of the great knowledge that we have today. So fourth reason is placing scientific discoveries and advancement in the context of other historical events is important. So for example, during the World War I, wherein unang gumamit ng gunpowder, and because of the use of gunpowder or the use of guns itself, nagkaroon ngayon ng need in surgical, especially in surgery for wound shots. So, placing those scientific discoveries and advancements have, in historical events, in some way, they have a very significant role or a significant place in those historical events. Fifth one is that learning about the history of science is a way to bring history alive for those not given to the humanities bent. As I was saying kanina, there were some great people who died early or maybe died in the course of their work because of discovering new scientific discoveries or advancement. So, yun. In that sense, some of them sacrificed their life. So, by learning the history of science, we get to know them better and parang nabubuhay sila while we are studying their works. 6.1, we see how science is influenced by culture. Dito natin makikita, through the course of our study ng history ng healthcare, makikita natin dun kung paano naapektuhan ng culture yung science in healthcare, especially health science. Okay? 7th reason, by learning about the history of science, we learn about the scientific revolution, one of human history's most important eras. So I think this is self-explanatory that as we learn the history, we also learn the scientific revolution that have happened during the different periods of time. So let's start by discussing the different events in healthcare during the ancient times. So let's get started. So let's discuss the different events under the ancient times. So the start is unknown up to 400 AD. So let's continue. So in studying the different events during the ancient times, ang naging basis lang ay mga remnants or fossils. So just like for this first one, the study of fossilized bones indicates many modern bone conditions such as arthritis, tumors of bone, inflammation of the bone, dental cavities, and infectious bone diseases. So by studying these fossilized bones and seeing what kind of conditions that it had undergone during the ancient times, it means that may mga different conditions, diseases and illnesses, just like arthritis, which are still present until today. That's why it's called modern bone conditions, kasi hanggang ngayon, these are still existing. And studying the fossilized bones, looking into it and seeing all these kind of conditions dun sa bones means that matagal nang mayroong arthritis na condition, tumors of bone, and all. Then also discovered were numerous healed fractures. So that means that yung mga tao nung ancient times, they do something to heal their fractures. Of course, ang fractures, they can heal on their own, but of course in perfect conditions dapat. So that means that people during those times uses something or are doing something para mag-heal yung fractures. So that's the implication of these discoveries. So we have answered now the question, what do this implies? So next, yung Egyptian mummies, those were during the ancient times din. Of course, we will not discuss anymore the process of mummification and all. Then next, belief system based on supernatural rather than natural laws. So during the ancient times, ang belief system nila nun ay based lang sa supernatural and not on natural laws. That means that they believe that the causes of disease were expected to be supernatural, meaning they were caused by maybe spirits, ghosts, or gods. So, ganun ang belief system nila nung ancient times. Then, by believing with such things, ang ginagawa lang nila to deal or to treat those diseases are home remedies, rituals, which are performed to drive away the evil spirits. So, ang paniniwala lang kasi nila nun, yung mga diseases are caused by evil spirits. And the things that they do to treat those diseases are home remedies and rituals. And ano nga ba yung mga different home remedies or rituals that they do during the ancient times? So, they can create loud noises, beating the ill person, or bloodletting. So, yung bloodletting, this means that they draw blood from the person. But of course, wala pang syringe nun. So, later, you will see what kind of objects or equipment that they use for bloodletting. Beating the ill person, ito, they beat or parang pinapalo nila yung may sakit na tao. I think some of these rituals or remedies are still uh, done by different cultures. Like sa Africa, yung mga nasa liblib or those who are living sa mga mountains, I think they still do these different rituals. So may mga cases kasi na ganun, may mga groups of people that are still believing that the causes of disease were spirits, ghosts, or gods. So this picture is the Egyptian mummification. So this was done, or this has started during the ancient times. So this one is a picture of a mummy. This one, yun nga, during the ancient times, they believed that diseases were caused by spirits, gods, or evil spirits. So this one depicts a priest that dive away the evil spirit from an ill person. This one naman is an example of amulets, or for us sa Philippines, we call this agimat. So during the ancient times, they also believed in such objects. So next is defining, which means boring hole through skull. So they have this practice nung ancient times wherein binubutas nila yung skull ng tao just to attempt to relieve headaches or epilepsy, remove evil spirits, or relieve the increased pressure caused by head injury. So imagine noon, if you have a head injury or headache or epilepsy, they will bore a hole to your skull. So, bubutasin nila yung skull mo. So, maybe hindi mo nga ikakamatay yung headache, pero yung treatment nila just to relieve the headache will kill you. So, this is a practice kasi nung ancient time. Of course, they don't have the proper knowledge pa. Okay? Next, preventive medicine consisted of wearing amulets and mutilating or painting the body to ward off evil spirits. So, ngayon, during this modern time, ang preventive measures natin is paghuhugas ng kamay, paggamit ng alcohol, proper hygiene, sanitation. But noon, of course, they believe na ang cause ng mga diseases ay evil spirits. That's why ang preventive medicine nila noon ay pagsuot ng amulets, just like what I have shown kanina, or agimat sa ating dito sa Philippines, or mutilating or painting the body. Mutilating, sinusugatan nila yung katawan nila, or maybe they do tattoos on their body, or simply a painting. Pinapaint nila yung body nila. So next. So this is an example of defining. So ayan, nakikita nyo, may butas talaga yung skull, and it's large. Hindi siya simpleng butas lang. So this one is the thing that they use to bore a hole to the skull of a sick person. Next. So, ang lifespan noong ancient times ranges from 20 to 35 years lang. So, why do you think so? Because, of course, mali yung ginagamit nila or ginagawa nilang treatment sa mga may sakit. So, imagine that they're finding, so, pwedeng ikamatay talaga ng tao yun if it is not done properly. So, next, chronic illnesses were rare. So, chronic illnesses means ito yung mga illnesses na pangmatagalan. So, rare siya noong ancient times. Next, we have Hippocrates, of course. He is the father of medicine. 40 to 50 books were attributed to him. He stressed that observation and conservative treatment. Health was balanced of 4 humors. So, ito yung main theory ni Hippocrates. Believe in healing power of nature and assist nature in healing process. Use dietetics as a means of balancing the humors. If diet failed, surgery and drugs na ang next step. So, yun. Si Hippocrates, this is Hippocrates. This is a sculpture of Hippocrates. So, yun. So, this figure depicts the theory of Hippocrates and his successors, which is about the 4 humors of the body. So he believed that the body consists of 4 humors, namely the black bile, the yellow bile, the blood, and the phlegm. So ito yung descriptions for those 4 humors. So kapag ang dominant sa'yo ay black bile, you are melancholic, and you have these different behaviors like moody, anxious, rigid, sober, pessimistic, and so on. And the same is true with the different with the other humors. So kapag blood naman ang dominant sa'yo, you are sanguine, and your behaviors are you are sociable, outgoing, talkative, responsive, and so on. So yun yung theory nila noon. So next. So let's go through with the medieval times. So it started noong 400 AD up to 1350 AD. So during the medieval times, 2 plagues killed majority of people and led to breakdown in civilization. So those 2 plagues happened during 543 AD and 568 AD. During this time also, monks preserved written medical texts, and monasteries served as centers of learning to maintain knowledge. During the medieval times, Christianity became increasing center of power, and they believed that disease was punishment for sins, possession by devil, or result of witchcraft. Of course, if religion ang nananaig noon, and there's no science about anything, especially sa occurrence ng diseases, they will believe that those diseases were because of punishment for sins, possession by devil, or dahil sa witchcraft. Okay? And yeah, these are monks. So yun. So monks were dedicated during the medieval times to write medical texts. And Christianity became or increasing power. So during the medieval times, Christians emphasized saving the soul, not the body. So therefore, ang treatment methods noon were prayer, penitence, and assistance of saints or the anointing of the sick. At kapag gumaling naman yung tao, they will consider it as a miracle. So these are their belief noon kasi nga religion yung nananaig, and there is no science yet during that time. Wala pang explanation about the occurrence of diseases. Then next, at the Council of Tours in 1163, the Church proclaims that they do not shed blood. Since most physicians were clergymen, they were no longer able to perform surgery. So since the Church proclaimed that they do not shed blood, it resulted to the stoppage of surgery or anything that will involve blood. So even bloodletting, they would not allow it during the medieval times because of the increasing power of Christianity at that time. So this one depicts anointing of the sick. And this one is bloodletting. So if you can observe dito sa picture, it's like a normal bloodletting. But this was done during the medieval times. And the difference is that they use different instruments to draw blood from the person. So, nakikita nyo, parang diretsong yung blood kinukuha nila and sinasalok lang nila sa isang bowl. And, yan. And during these modern times, ang ginagamit natin ay syringe. So, noon, of course, walang syringe. That's why sinasalok nila ng bowl yung dugo. And this So later, I'll show you yung instrument na ginagamit nila for bloodletting. So first, let's discuss this. So surgery and bloodletting were turned over to barbers or barber surgeons yung tawag nila noon. So barber surgeons were medical practitioners in medieval Europe who, unlike many doctors of the time, they performed surgery and often sa mga war wounded. So, yun. They call them barber or barber surgeons. Next, the title of doctor became known and major legislation was written in 1140 and 1224 that specified a 9-year curriculum with state examinations and licenses. The regulations also address use of pharmaceuticals and control of city hygiene. So, during the medieval times, dito nag-start yung paggamit sa term na doctor and it's already controlled and may specified na curriculum for becoming a doctor. Then, medicine became an official profession although there were not enough physicians for the population. So, may medicine ng profession during the medieval times but not enough still for the population. So ito, this is an example of bloodletting. So yun nga, kung sabi ko sa inyo kanina, they do not use a syringe, of course, kasi wala pang syringe noon. So sinasalok nila yung blood na nakukuha nila during bloodletting. Then, so these are the instruments that the barber surgeons would use to draw blood from their patients. So, hindi siya yung conventional na syringe natin and hindi siya maliit. So, this one ranges or this one have different sizes. So, ayan. So, imagine if one would still use this for bloodletting. So, I think wala nang sasali ng bloodletting activity pag ganito na yung ginagamit ng mga instruments. If ganito pa din yung ginagamit na instruments. So next. As a result, lower class citizens still relied on barbers and lay healers. So since yun nga, konti pa rin yung doctors or nag-aaral ng medicine noong medieval times, which is not still enough for the population, most of the people during the medieval times, especially the lower class citizens, still relied sa mga lay healer and barbers. Then, Black Plague of 1348 killed large percentage of European population. So, Black Plague is a pandemic, but the difference is that the Black Plague was caused by a bacteria. So, yun. So during the Black Plague nung 1348 or nung medieval times, the concept of quarantine as preventive measure was recognized. Public health measures were instituted for the first time when the food in markets came under control. So, yung concept ng quarantine started nung medieval times during the Black Plague. So, yun nga, yung hinihiwalay yung may sakit sa mga walang sakit, or they would put them in a specified place, lahat ng may sakit, because they already knew that time na nahahawa yung healthy person sa infected person. So, yun. Dito pala nag-start ang quarantine. So, this picture depicts a plague doctor. So, yun. May mahaba siyang robe, meron siyang hawak na stick, meron siyang mask, which is ibon ang itsura. And they wear this cap, okay, or hat. So, ganito yung itsura ng plague doctor. So, I'll show you a video wherein i-explain doon why they have this kind of outfit. So, next.
Back in the Middle Ages, there was no cure for the plague. But that didn't stop people trying pretty much anything to avoid succumbing to this terrifying illness. The Wellcome collection in London holds records of many of the supposed and rather bizarre cures for the plague.
So one of the things I have here is a manuscript from the end of the 15th century.
Dr. Elmer Brenner is an expert in the strange world of the medieval doctor.
The plague charm that we have here on this page, they're using the format of the circular diagram, which is a kind of universal medieval format, to give protection against pestilence. These charms quite often have some kind of instruction to write them on the body, sometimes in blood. But you could do other things with this. You could copy it onto a scrap of paper and carry it on your body, for instance.
Of course, doctors did exist in medieval times. Unfortunately, they were as clueless as their patients as to the real cause of the plague. But that didn't stop them profiting from it.
Physicians quite often got bad reputations for being very wealthy and shamelessly charging a lot of money for their advice.
Now, look, another thing I want to ask you about is because the image I have in my mind is of a plague doctor with a special costume. So I've actually acquired for myself the sort of thing that people would wear.
Yeah, and obviously it's something that looks strange to us. It actually comes from continental Europe, so particularly France and Italy.
The Europeans settled on this look in the 17th century, proving they could even deal with the plague more stylishly than we could.
So this is the outfit I've got on, all but the top bit.
Yeah.
So the gloves are more like motorcycle gauntlets,
Yep.
which obviously would protect against the germs getting in. And I've got a big stick. Now, what's this? Is this just a standard stick, or did it have some function, do you think, as a plague doctor?
Yeah, I mean, I think it adds to the distance from the patient.
Yes.
He wouldn't have to go up close to them.
So he could say, look, you've got buboes there.
Exactly.
This is virtually the barge pole that you don't want to touch things with. Now, I suppose this is the most fascinating thing.
The beak was there so that there would be something in front of the respiratory area that was filled with heavily aromatic plants that were understood to purify the air.
Is this what the plague doctor might look like?
Yeah, I mean, what we can say is that this would be a physician that you would encounter and you would not be able to see his face at all.
Right.
So in that sense, it's more of a negative than a positive encounter, I think it's likely to say.
Right, well, I have to move on. I've got a lot of other patients to see. You've got the plague. You've got about 2 weeks to live. I wonder if you could pay the money for my fee on your way out.
Back in the Middle Ages, there was
So that one shows the or explains the outfit of a plague doctor. So kung mapapansin nyo, parang yung doctor lang din ngayong pandemic wherein they were PPE, gloves, and a mask. Okay? So parang ganun lang din noon. But noon, iba yung itsura. Okay? But still, they already have the idea of protecting themselves from infection. So this picture depicts quarantine noong Black Plague. So, ayun, nakahiwalay yung mga may sakit and they just distribute foods to them. So, next. So, control of prostitution also was initiated to prevent spread of disease. Network of hospitals were built. So, may mga hospitals na noon. And it marked a new and more humane approach toward the ill. So, noon kasi, medyo yung mga treatment nila sa tao kapag may sakit is hindi humane ang approach or hindi makatao. But ngayon, mas okay na yung trato nila sa mga may sakit. Oh, so yung succeeding pictures kasi they show they show prostitution. So, ayan. So, kaya kung mapapansin nyo yung mga paintings ng medieval times, which came from medieval times, ganito or something sexy yung theme ng kanilang mga paintings. So, because nung medieval times, yun nga, medyo kalat ang prostitution noon. And ganito yung hospitals nila during the medieval times nung nag-start ng magkaroon ng hospitals. Yan. Also, hospitals. And let's proceed to Renaissance. So, it started noong 1350 to 1650. So during the Renaissance period, there was a revival of learning and science. So there were first attempts to connect autopsy results with clinical observations made during life. So ngayong Renaissance, kinoconnect na nila yung autopsy results dun sa mga observations that have done nung buhay pa yung tao. Next, accurate anatomical drawings are now available or were now available for study. So may mga anatomical drawings na ng tao nung Renaissance period, and there was a tremendous growth in inquiry of how body was structured and how it works. So parang nagkaroon na ng curiosity yung medical field during the Renaissance period on the structure of the body and paano nagpa-function yung different structures sa katawan. So this one is ganito mag-study yung mga physicians noon. So they would have this autopsy in front of the students for them to learn yung structure ng katawan or the physiology of the different structures. So during the Renaissance period, numerous dissections were performed by Andreas Vesalius and others. So, si Andreas Vesalius is a Renaissance physician who revolutionized the study of biology and the practice of medicine by his careful description of the anatomy of the human body. So, also, Andreas Vesalius is considered as the founder of modern human anatomy. So during the Renaissance period, there were also many clinical advances that were made, just like the bedside teaching of physicians. So, ang bedside teaching, ito yung a doctor who would treat his patient would have his student beside him or beside the patient. So that's how students or medical students learn during those times. So parang actual na ino-observe ng student yung physician together with the patient. So next, despite the new advances, it was still a time of tremendous filth in the cities and its people, the spread of disease, and extreme superstitions. So may mga superstitions pa din noon, and there was no sanitation or proper hygiene pa among the people during this time. So this is Andreas Vesalius. So Pierre Brissot spoke against bloodletting and died in exile. So nung medieval times kasi, may mga bloodletting pa ding nangyayari for the treatment of diseases, and of course we know now na this is wrong, but then during that time practice pa din kasi ito. And Pierre Brissot was one of the people who fought and attacked this practice. So Pierre Brissot is a Paris physician who stressed the importance of bleeding near the locus of the disease. He was declared a medical heretic by the Paris Faculty of Medicine, and derivative bleeding was forbidden by an act of the French Parliament. Then, in 1518, Brissot was exiled to Spain and Portugal. Then, in 1539, the celebrated anatomist Andreas Vesalius, which we discussed kanina, continued the controversy with his famous venesection letter, which came to the support of Brissot. So, though si Pierre Brissot, he died in exile, fighting for the right thing, Andreas Vesalius continued to support Pierre Brissot. So next, study of plants greatly expanded as travel between countries increased. So of course, people can travel nung Renaissance period. That's why nagkaroon ng great knowledge about different plants or study of plants, specifically botany. Okay. Then plants were the main source of drugs, and 500 new plant species were categorized, and first modern pharmacopoeia was written. Yeah. Then this is Pierre Brissot. Next, Girolamo Fracastoro wrote a book in 1546 in which he presented the first theory of contagious diseases. So it was not taken seriously and would not be proven for several centuries. High incidence of infections continued, as not even hand washing was done between performing autopsies and surgeries. So during that time, kapag nagpa-perform silang autopsy or surgery, hindi sila naghuhugas ng kamay. That's why ayun, may mga contagious diseases pa din noong Renaissance period. So we know that hand washing is a critical procedure before a surgery. So imagine nyo noon, walang hand washing sa mga surgeons before performing a surgery. Next, efforts were made to interpret miracles in a rational way. So, dito parang nag-expand na yung knowledge in science. That's why they are now interpreting everything in a rational way. So, instead that those things happen because of miracles, ngayon naghahanap na sila ng explanation or a rational explanation for what have happened. Next. So this one is Girolamo Fracastoro. Then insight developed into the role of psychological factors influencing disease. So noon wala pang knowledge about the psychological well-being of a person, but now they are correlating psychological factors to diseases na. Then printing press invented, which allowed for widespread distribution of new information and books. So nagkaroon na ng printing press, so that's why nagkaroon na din ng mga papers, publication, and all. And because of that, naging widespread na yung distribution ng bagong information among the people. Then the invention of gunpowder resulted in a numerous gunshot wound during frequent wars. So because of the invention of the gunpowder, of course, they would use it for a gun, and of course the gun would inflict gunshot wounds among the people. Then this means that there is a need now for surgical treatment of wounds, and this one elevated because of the invention of the gunpowder. So dahil dito, nagkaroon ng high status ang mga barber surgeons, of course because they are in demand during wars because of treating gunshot wounds. So this is the old printing procedure nung Renaissance period. So let's discuss the different events that have happened during the 17th century. So during the 17th century, there was an increasing interest in experimentation and observation. Studies in anatomy continued, but the study of physiology was also now investigated. During the previous periods kasi, ang focus nila nun ay more on sa structure or anatomy ng katawan. But now, they would study the function of those different structures. Then we have here William Harvey, who is an Englishman, stated that blood circulates the body within a continuous network of vessels, but only the mechanical aspects of the system were addressed. So, alam lang nila noon that there were these vessels and the blood circulates to these vessels, but then they do not still know the different roles or the different types of vessels or kung ano yung role ng vessels in the body. So hanggang dun lang yung limit ng knowledge nila during the 17th century. Then this is William Harvey, and these are some of the anatomical drawings during the Renaissance period. So vehemently opposed at first, this discovery led to the realization that medications could be injected into the circulatory system and also blood could be transfused. So nung na-discover na may blood vessels and that blood flows through them, nagkaroon ngayon ng idea that medications can now be injected through those vessels and also blood could be transfused through those vessels. Then, after many failed attempts, it fell out of favor for several centuries. So, bakit? Kasi, of course, they still do not know how to do it properly, just like for blood transfusion. They do not know that there are different blood types and kailangan magkapareho kayo ng blood type so that the blood can be transfused to that person. But noon nga, hindi nila alam ito, that's why it fell out of favor for several centuries. Then advances in the understanding of other systems were also made, just like digestion and respiration. So a greater understanding of how the lungs add oxygen to the blood and how food is digested. But further understanding was limited by lack of advancement in chemistry, which underlies the function of these systems. So yun, we can just understand actually the digestion and even breathing or respiration if we have knowledge in chemistry, like the oxygen and the enzymes that are involved in digestion. So, yun. They do not have that kind of knowledge pa nung Renaissance period. Then in 1666, Anton van Leeuwenhoek invented the microscope. Of course, alam niyo na to. Then, this is Anton van Leeuwenhoek. And this is the old microscope. So, ito, I know nakikita nyo na to sa books, but then this one, this is the first type or kind of microscope that they are using during the Renaissance period. And I've searched for this one, kung paano ba to ginagamit noon, but because if you look into it, parang how would they use it, diba? So, ang ginagawa pala nila noon, a droplet of water would be put, or the specimen, nilalagay nila dito sa circle na to, and they would look into it on the other side of this one. So, parang it's a kind of parang magnifying glass siya. Parang ganon. But of course, I cannot explain thoroughly kung paano ba talaga or ano yung nakikita nila dun sa specimen, if it's enlarged or what. So, next. So the study of microscopic anatomy and visualization of organisms are now possible. Germs were only viewed under the microscope, and the connection with disease comes several centuries later. So, of course, because of the invention ng microscope, nakikita na nila yung mga microscopic organisms, the bacteria, the protozoans, and so on. But then, they still do not know that those can, or some of them, some of the bacteria or some of the microorganisms causes diseases. Okay? Then next, quinine imported from Peru as a cure for malaria. So nagkaroon na ng cure for malaria noong 17th century, which is quinine. Then they separated malaria from the other types of fever, then confirmed the idea that specific diseases have specific cures. So ayan, nagkaroon na ng idea that some diseases have specific cures, that for example, itong quinine cannot be used to treat the other types of fever, that quinine is only specific for as a cure for malaria. So, nagkaroon na ng idea na ganun during the 17th century. So, this is quinine. Ito. So the study of brain and psychology was of interest during this time, but prior to this time, there was a common belief that the soul resided in the pineal gland and the rest of the body was purely mechanical in nature. Actually, may mga organizations pa, may mga scientists pa na naniniwala that soul still resides in the pineal gland. Then, nervous system and simulation of muscles were discovered. So, parang during the 17th century, nagkaroon ng interest ang mga medical people sa pag-aaral ng brain and the nervous system. The long-believed theory that mucus from a heat cold was produced by the brain was disproved. So there was this notion kasi noon, or paniniwala, na ang mucus daw pinoproduce siya ng brain. And that was disproved. Then Thomas Sydenham reported that 50% of his non-fever patients, male and female, suffered from hysteria or psychosomatic illnesses. So during this time, kinoconnect na nila yung common diseases sa neurological issues din. So sabi nga natin kanina, there was a growing interest na sa study ng brain and psychology during this time. Then, medical universities were still teaching straight theory and not clinical skills. So, ang mga medical universities noon, ang focus nila ay theories and not the skills talaga na kailangan for their practice. So, yun yung events during this time. Then this is Thomas Sydenham. Also taught was frequent use of purging and bloodletting. So, yung mga medical universities noon, they would still teach purging and bloodletting as a form of treatment sa mga diseases, which is wrong. So, great discoveries were also made not by the medical universities but by the academies and societies of learned researchers. So, noon kasi, though may medical universities na, but yun nga, they focus on theories kasi. That's why there were these groups of academies and societies na mga researchers which focuses on discovering new knowledge noon, and most of the discoveries at this time sila sa kanila galing. So first medical journal was published by the academies in an attempt to communicate discoveries. So nagkaroon na ng medical journal that time which gives or updates or give updates on the recent discoveries that they have. So let's proceed with the 18th century. So researchers and theorists still struggled with an explanation of how the body functions. So there were three theories that were first proposed. First, the body functioned like a hydraulic pump that was run by an undefined fluid flowing through the nervous system. So they believed that time that or they theorizes that time that the nervous system is being driven by an undefined fluid. Then next, every disease was the result of overstimulation or inability to respond to stimulation. So noon kasi yung mga ill person, they would be seen as some are aggressive, tapos yung iba naman matamlay and kahiga lang, mga ganon. So that's why nagkaroon silang idea that it can be a result of overstimulation or their inability to respond to stimulation, and they would treat them. So ang treatment noon is either by a use of a depressant or a stimulant. So a depressant reduces the functional or nervous activity, while stimulant increases alertness and energy ng tao. So an example of a depressant is alcohol. So kung napapansin nyo, kapag lasing yung tao, they would be groggy and most of them would talk about emotional topics. So depressant kasi siya, or they would feel depressed or naiiyak sila, ganun. Naging emotional sila. So that's the effect of a depressant. Ang stimulant naman increases alertness and energy. Nagbibigay siya ng energy dun sa tao and mas naging alert yung tao. That's why maraming na-addict sa narcotic drugs or sa illicit drugs. Then, third one, direct clinical observation should be used to define and categorize diseases. So, noon kasi, they would just categorize the disease or they would just identify the disease after the person dies. So, based on autopsies lang. But then, they should, yun nga, categorize the diseases based on what they have seen or observed nung buhay pa yung tao. So, 2,400 diseases were described, but some are just the same because of varied symptoms during the 18th century. Then, surgery became a respected form of treatment in France after the court physician successfully repaired an anal fistula for King Louis XIV. Then surgery was upgraded from a craft to an experimental science. Then in 761, Giovanni Battista Morgagni of Padua published a comprehensive book entitled On the Sites and Causes of Diseases. So this is Giovanni Battista Morgagni. He is an Italian anatomist, generally regarded as the father of modern anatomical pathology, who taught thousands of medical students from many countries. So, ito siya. Then, so from concentration on general conditions and humors to specific changes in organs. So noon ang focus nila is yung buong katawan ng tao, but now they would study specifically the different organs of the body. Then, science of chemistry came of age. Digestion is now seen as a chemical process. Then, the philosophy of enlightenment was developed that stressed the rational approach to problems and dissemination of knowledge for others to read. So, everything now should be seen as rational, or lahat may explanation dapat, and they would not rely more on superstitions and supernatural beliefs. Then dissemination of knowledge for others to read is also emphasized during this time. So numerous studies and experiments and sharing of knowledge with others added to the increasing pace of progress. So during this time, na-emphasize kasi that there should be a wide dissemination of information, and because of that, nagkaroon ng mabilis na pace ang progress in terms of the medical field. Then focus went from belief in the devil and possession to recognition of mental illness as a disease. Previously, patients were locked up in filthy conditions. So noon, from paniniwala sa mga devils or evils or sa possession, they are recognizing now the presence of mental illnesses, and they consider it now as disease. And noon, yun nga, they would not treat right yung mga patients with mental illnesses, but now they would put them or treat them in a more humane way. Then preventive health came to the forefront in the form of public health, sanitary reform, and personal hygiene is now improved. Then interest in child health increased, or pediatrics ito. Then Edward Jenner demonstrated that vaccination with cowpox provides immunity for smallpox. So this opened door now to the investigation of other vaccines. So the discovery of Edward Jenner of the vaccine for smallpox, actually yung ginawa niyang vaccine is for the cowpox, but accidentally they discovered that it also provides immunity against the smallpox, and because of this, nagkaroon na ng mga investigation on the other vaccines. So this is Edward Jenner. Then let's proceed to the 19th century. So hospitals were built that could hold many patients during the 19th century. There were advances now in physiology, and emphasis moved from individual organs to the identification of the more specific tissues. So ngayon naman, ang focus na nila or ang interest na ng mga tao ay more on the specific tissues. Then there was an increase in medical knowledge during this time. Physicians and surgeons were united into one profession. Next. So, medical professions started to develop specialty areas. So, nagkaroon na ng specialty or specialization sa medical profession. The study shifted from practicing physicians to full-time scientific researchers. So, dito na nag-umpisa yung pagkakaroon ng scientific researchers under the medical profession. So more powerful microscopes were also developed during this time. Human tissue could now be seen at the cellular level. So of course, it's because of the powerful microscopes that we already have now in the 19th century. So there were also advances in chemistry during this time. So these are some of the powerful microscopes during the 19th century. So of course we have now more powerful microscopes. So pharmacology was also established as a new science. Dentists introduced anesthesia, and this practice expanded to major surgical procedures. So dentists pala ang unang gumamit ng anesthesia, which led to its use sa other major surgical procedures. So because meron ng anesthesia at nagagamit na siya sa surgery, mas large or large scale na yung mga surgery ngayon during the 19th century because of the anesthesia. Then, vivisection or operation on living animals was routinely performed in the desire to study more accurate and detailed functions. So, they were now using animals as guinea pigs to study more accurate and detailed functions ng different structures ng body. So, but then, this led to ethical issues. So, these are some of the pictures ng vivisection noon. So, noon, gumagamit din sila ng tao to study. So, some of the general public questioned ethics of the procedure, yun nga, nung vivisection. Then, the first school of nursing was created in 1836 by the German clergyman Dnr Order. So, it's called Deaconess Training Center. That's the first school of nursing. Then, the Ministry of Deaconess is, in modern times, a non-ordained ministry for women in some Protestant churches to provide pastoral care, especially for other women. So mostly noon ang mga nurses, they are under a non-ordained ministry for women. So mostly mga babae noon ang nurses. So this one is Theodore Flidner, and these are some of the pictures nga ng first nurses. But I think this one sa Philippines ito. Because look at their faces. They look like they're Filipinos. So I think namali lang ko ng picture na ilagay dito. So, yeah. So these are some more pictures of the first nursing school. So the school also served as an inspiration to Florence Nightingale, who is an English woman whose work in the field hospitals during the Crimean War made her a powerful influence. She opened a school of nursing in 1860. So this is Florence Nightingale. Then, Louis Pasteur, a chemist, proved that specific microorganisms called bacteria are the cause of specific diseases in both humans and animals. The results of his work created the development of the germ theory. So this is Louis Pasteur, and pasteurization now is used, and pasteurization is the process of heat processing a liquid or a food to kill pathogenic bacteria to make the food safe to eat. So commonly sa ang pasteurization, commonly we hear this term sa uh, dairy processing. Yeah. Then germ theory states that many diseases are caused by microorganisms. Then specific identification of microorganisms led to the development of vaccines for prevention. In 1864, Lord Joseph Lister applied the germ theory to his surgical practice by reasoning that microorganisms could also fall into open surgical wounds. So, sinasanitize niya na muna yung open surgical wounds when doing surgeries. That's why Lord Joseph Lister is also known as the father of antiseptic surgery. Then, in 1867, Adolphe Kussmaul used a stomach pump to treat stomach diseases. It increased knowledge in dietetics and use of tube feeding. So, yun yung contribution ni Adolphe Kussmaul, yung stomach pump. And a stomach pump looks like this, no? Ganyan siya ginagawa. And this is Adolphe Kussmaul. So, again, in 1867, Adolphe Kussmaul used a stomach pump to treat stomach diseases. So, naulit lang siya. So, again, this is Adolphe Kussmaul. Anesthesia, asepsis, or the absence of bacteria or any other microorganisms, and invention of variety of surgical instruments changed the face of medicine forever. Many more advanced surgeries, because of the invention or discovery of these things, could now be performed. Then, psychiatry had come to a dead end as it eluded the scientific advances. No satisfactory explanation of mental illness could be given. So, yun. Actually, even now, some mental illnesses that do not have cure kasi nga some of them are still unexplainable. And also, the study of the brain is still pending, or the brain itself is still a mystery because ang dami pang pwedeng, or ang dami pang questions about the brain that cannot be answered, and there are a lot of things that are yet to be discovered about the brain. So next. So Sigmund Freud, or Sigmund Freud, and Joseph Breuer developed the theory of psychoanalysis. The theory was based on using hypnosis to allow patients to recall prior traumatic and repressed events. So actually they started now the psychology, the study of psychology. Then, preventive medicine makes great strides as pasteurization, vaccination, asepsis, and sanitation are implemented. So the lifespan now during the 19th century increased from 40 to 50 years. So mas mahaba na ang lifespan during this time kasi nga there are a lot of major discoveries during this time. Kaya mas mahaba na yung life expectancy for the people during this time. So this is Sigmund Freud and Joseph Breuer. So 20th century. So in 1921, Karl Landsteiner of Vienna discovered blood groups. So because of this discovery, it made blood transfusion of blood products safe for the first time in history. So noon though, blood transfusion, may idea na yung mga tao about blood transfusion, but then they don't have any idea yet about the different blood groups. That's why during that time nag-fail. But now, yun nga, na-discover na ni Karl Landsteiner yung different blood groups. That's why safe na ngayon ang blood transfusion. So Frederick Grant Banting of Toronto and John James Ricard MacLeod identifies insulin in 91 for treatment of diabetes. So they discovered the insulin. Then, large-scale vaccination programs were conducted during the 20th century. Biomedical engineering is made possible with the invention of the computer. So this is Frederick Grant Banting and John James Ricard MacLeod. So X-rays, electrocardiograph or EKG, electroencephalograph or ECG, ultrasound, pacemakers, dialysis, and tomography provided physicians with more diagnostic and therapeutic tools. Vitamins were also discovered by Casimir Funk, and the belief that all diseases were caused by microbes is disproved because, of course, some diseases or illnesses are caused by a deficiency of vitamins. Then, new synthetic drugs were also developed to treat specific problems during this time. Then, chemotherapy was now used to fight cancer. Antibiotics were developed to fight various infections caused by bacteria, and there are treatments na ng allergies during this time. So, ang lifespan during the 20th century is 70 to 80 years. Geriatrics became a specialty. So, ang geriatrics, they focus on the care of old or older people. Then chronic illnesses are very common. Then mental illness became an increasing problem in modern society as we are experiencing ngayong 21st century. Mental illnesses also became an increasing problem. So other healthcare specialties develop and specialize as knowledge base increases. So there was an increased number of people who come in contact with the patient and who view the concerns from a specialty focus versus holistic perspective. So comparing kasi noon, there is just a general practitioner who would check you up and who would help to treat your illness or disease, but now may mga specialized people na who would give a diagnosis or will try to treat your disease. So healthcare costs increase due to this increase in specialization of knowledge, and of course because of the technological advancements. So of course ngayon during the 20th century may mga technology na ginagamit like the ECG, the EKG. So, of course, that would cost more ngayon. So, that's the effect of the technological advancements and the development of the different healthcare specialties. So because of the high cost of healthcare, it became now a social issue. Does everyone have an equal right to healthcare? So up until now naman, this is still debatable. Then next, transplantation of organs is now possible. So may mga pagtatransplant ng organs just like kidney and liver na nangyayari during this period. Then people can be kept alive by mechanical means through the life support system beyond the point of having any quality of life. Emphasis placed on people having written living wills to specify what they do and do not want to be done to prolong their lives. So, we have nga yung Dnr Order, or a Do Not Resuscitate Order, which is also known as a No Code or Allow Natural Death. And this is a legal order, written or oral depending on the country, which indicates that a person does not want to receive cardiopulmonary resuscitation or CPR if that person's heart stops beating. So sometimes it also prevents other medical interventions. So depende dun sa pipirmahan nung sick person. So sometimes if the person is not capable of signing, or kunyari comatose siya, of course the immediate family would be the ones who would decide for that person. Okay, next. So England opens first hospice in 1967. So hospice care is a type of healthcare that focuses on the palliation of a terminally ill patient's pain and symptoms and attending to their emotional and spiritual needs at the end of life. So hospice care prioritizes comfort and quality of life by reducing pain and suffering. So hospice, they focuses on the care of terminally ill patients. Then next, during the 20th century, there was a development of new and faster machines. Mass media is now available to the public. Genetic research is now into the cause of certain diseases and conditions. Then, in 1978, the first test tube baby was born in England. I think her name is Louise Brown. And I think she was born in July 25, 1978. So, yeah. In 1981, AIDS is identified as a disease. So, yeah, this is a Louise Brown. So, Louise Brown is the first test tube baby. I think she's 43 years old now. And this one is the first successful cloning of sheep in 1997, which opened door for human cloning and growth of organs for transplantation. This is Dolly, and he is the first cloned animal. Then let's proceed to the 21st century, which is the current period we are in. So, these are some of the hopes for the new millennium. First is vaccine to prevent HIV, also cure for AIDS, cure for obesity, cloning of organs for transplantation. Ngayon kasi do there may transplantation ng organs, but then it depends if may donor or may available organ. But then if cloning would be done sa organs, it would be very easy for us to do transplantation. Then, of course, cure for cancer and life expectancy of 100 plus years. Though, may mga umaabot na ngayon ng 100 plus. But then, kakaunti lang sila. Then, next, less invasive diagnostic and therapeutic treatments and medications with less harmful side effects will be developed. So of course, this would be great if yun nga, maging less invasive na ang mga diagnostic and even the treatments and medications. So, that's all. And yun, when healthcare workers several centuries into the future look back at the 20th century, they will be astounded. So of course, this would also be our reaction when we look back to the previous centuries and are mystified by the ignorance and resulting unnecessary human suffering. So, yun nga, if babalikan natin yung mga nangyari noon, we would consider them as ignorant, and there were unnecessary treatments or actions noon na kung consider natin ngayon would be very fatal or not appropriate. So, maybe in the near future, ganun din ang magiging tingin natin sa mga practices natin ngayon. So, that's all for the history of healthcare, and I hope you have learned a lot in this session. So, thank you everyone. God bless and keep safe.